Man, I'm just shocked I'm only 3 minutes late. All right, Sonny, if you'll let me know when we're ready to go. We're good?
Yes, sir. Hey folks on the call, media, this is Cody Hall of the Governor's Office. We're going to run this pretty similar to what we did with the nursing home roundtable. For everyone on the call, the governor will lead us off, and then we'll go around the room for a brief update, and then we will ask everyone to exit the call. But again, if anyone would like a copy of the governor's remarks, please shoot me an email, and hopefully our audio will be working a little bit better today. If anyone has any issues with the audio, everyone I think on the call, or most people have my cell, just shoot me a text.
All right, well, good afternoon, everyone. First of all, let me just thank you all for joining us. I know we have some other folks that are on the phone, and I will just reiterate to the members of the media that this group we have of hospital CEOs and representatives of the facilities that have been literally working together for months and months and months now has been invaluable. I know to myself and Dr. Toomey and Commissioner Berry, who are here with us today. Also, our insurance commissioner, General John King. I know General Cardin's not here, but we have all been intertwined with our hospitals and medical facilities around the state. And the feedback, suggestions, us working together through this whole process with you all has really, I think, put our state, despite the challenges we've had, in a very good situation, or as good as it can be in the middle of a worldwide pandemic when you look around the rest of the country. So I just want to, first of all, thank you all for your time. I know you're very busy, but it is very helpful to us, including the different organizations, Anna and others that we have that are representing the different hospitals around the state. I wanted to take just a few minutes to give you an update on what we're seeing, and obviously, more importantly, we'll hear from you all on what you're seeing in regards to COVID as we move into the holiday season. As you all know, we've been preparing for a long time now under the leadership of General King, Dr. Toomey, Frank, the rest of our team on the deployment of the vaccine to the priority populations in the next few weeks. I know that you all have been engaged in that as we have. I know and really appreciate, and I hope you'll continue to pass this along to all those that are in your facilities that have been working hard for a long time now in unprecedented times, and how much we appreciate the toll that is taken on them. I mean, I've visited a lot of hospitals. I've talked to a lot of nurses and docs and other folks that are in there, and I've heard from them how grueling this has been at certain times, and I just keep all those folks in my prayers, and I'm very grateful for how much they're battling every day, just like you guys are. So I hope you'll pass that along. I know that I can say that we're going to continue to support you any way that we can. We're obviously watching the end of the year with CARES Act funding and other things, and hopeful that we can continue working through that. But we're all in until we can get the vaccine distributed and get rid of the virus, or at least get herd immunity, or whatever is going to happen. We're going to continue to stand with you. It's no secret that here in Georgia, we're seeing increases in our COVID data all across really all the key metrics. And, we are continuing to meet and watch those numbers daily, and have, 2 or 3 calls a week, getting updates from the whole team, Dr. Toomey, Commissioner Berry, and the rest of our team. And obviously, I've the whole pandemic really watched our hospital numbers very closely. I talk with many of you often about that, so we know exactly what is happening in your facilities, and then also with the tragic losses that we've had with COVID. I'm certainly glad that our numbers are where they are now and not worse. One death to the virus is one too many. And we just want to continue to mitigate that as much as we can until we can get the vaccine out. We're obviously continuing to work with Dr. Toomey and her team at the Department of Public Health, as well as Commissioner Berry. And I want to thank Frank again for being here today. Him and his team have done a lot of really good things a lot of people never talks about, working with all of us on hospital staffing, but also just on the emergency actions we've taken to let you all ramp up bed capacity in your facilities to care for your patients. And I doubt many people are going to thank Frank and his team for that, but they've done a great job, and I want to do that in front of you guys. But we're going to continue to work with you on all of those type resources that your facilities may need, or any threats that you may have in the days ahead. I can tell you that Director Stallings at GEMA has been updating us at least twice a week on our PPE supplies. We continue to be in great shape there, just getting ready for tomorrow or next month or whatever may be in front of us. And I know we stay in touch with you all in that regard, so we are continuing to monitor that. We're also watching the data on our nursing home cases, and I know many of you, I know Candace and John and others, well, really probably all of you are tied to your local facilities that you're working with. We're seeing the number of both cases in nursing homes and active hospitalizations still below our summer surge. But we also realize anytime around the holiday season, people letting the guard down, you have family gatherings, that makes nursing homes susceptible as you have staff that's coming in there. And so we're continuing to work with them on that as well as testing. I certainly want to thank you all, and I talked to our long-term care facility folks this week as well about the vigilance of people just following the guidelines, using best practices in the hospitals. And I know that we talked, months ago about assuring people how safe it is to come into the hospital because of the protocols you have, the PPE, and just kind of how you're handling regular patients, COVID patients. And I want to thank you for continuing to do that. And we continue to work with the nursing homes in that regard as well to keep your visitors and residents and families and everyone else that you're serving safe in that environment. The message that we heard from the nursing home community, and I know that this is the same for you all, is that staffing continues to be a big challenge. It is a tough environment for these folks, to say the least. It's also a competitive environment. I know we've talked about that a lot with other states and jurisdictions trying to pick your staff off that for whatever reason may have the cash and funds available to do that. So we're continuing to work with you all on that. I will tell you that, again, I'm very thankful to our team led by Commissioner Berry with how successful, including Ryan Loke and a lot of other people, of dealing with the private sector to provide temporary staffing. And we've spent tens of millions of dollars. I guess, gosh, I think by the end of the year, we're looking at about a $250 million spend of CARES Act funds just for staffing. And I know that I've heard from many of you all that have been thankful for that. I'm thankful to our team for being as successful as we have been, because it is a very competitive environment out there. And we're going to continue to do all that we can through the end of the year to try to continue to help everyone. I think right now we've helped, at least in some way, 56 different hospitals throughout the pandemic. We also, as you know, have extended staffing through the end of the year, which I just sort of mentioned, and we'll continue to work with you as we find ways to provide the level of patient care that Georgians are accustomed to seeing as we battle COVID. And I would also just mention how encouraged I am and cautiously optimistic probably a little more every day in regards to Operation Warp Speed. I don't think the administration has gotten quite enough credit for how unbelievably fast that has rolled out. And I know that many of you all have been involved in that some way or another, either in development or the trials. But we are working with FDA and CDC regarding the Moderna and the Pfizer vaccine. And as you're well aware, yesterday the CDC Advisory Committee on the Immunization Practices met to finalize the priorities for the phase 1A when the vaccine becomes available to healthcare workers and long-term care facility residents, and the state intends to follow those guidelines and match those prioritizations. But I will tell you that under the leadership of General King and Dr. Toomey, and really the rest of our whole team, we're going to be partnering with a lot of different state agencies to make sure that we have the delivery means that we need, and to get that moved out as quickly as possible and continue that as long as we need to. We'll also continue to work with the stakeholders, including yourself, about the next steps of the vaccine distribution, the eligibility of our citizens for that, to make sure that we have all the bases covered, no matter where in Georgia you might be. The FDA committee is set to meet to review the Pfizer application on the 10th. We expect that within a few days following that meeting, we'll start receiving the first shipments of the vaccine. So that is fast approaching. I know that your teams have been working hard, and we will continue to be working with you and the Hospital Association to ensure that we have the latest information and that you're getting that, so that we're all prepared and continuing to work together. Lastly, I know I don't have to remind you all of this, but I don't want Dr. Toomey to slap my hand over here. I want to remind everyone that as the colder months approach, we got to continue to remain vigilant. You know, we had a really, I think, good message before Thanksgiving. I was pleased to see so many people on social media posting about how they had smaller family events, and I'm thankful for that. I also would encourage those that maybe got in a situation where that wasn't the case and they went to a larger event, that they should go get tested and be very careful here for the next week or two to socially distance, wear their mask, follow the guidelines, or stay at home, and let's continue to mitigate the spread. But we cannot take our foot off the gas just because we're going to have a vaccine in a couple of weeks or in 30 days or so. We got to continue to educate people that even with the vaccine coming out, it's going to take months to get that distributed and for that to get kind of baked in, if you will. And we're going to have to all continue to remind people of the best practices, as well as the importance of getting your flu shot. I'm looking forward to hearing from you all on flu activity, or hopefully not, that's going on right now, so that we can continue to avoid the twindemic. And I think with that, I'll wrap up here, and again, just say thank you guys so much. I'm going to turn it over to John, and we'll just kind of give everybody a couple of minutes as we go around the room, just give us a quick update, and we'll try to answer any questions that you have.
Thank you, Governor. Thank you. John Hoppert, President and CEO at Grady Health System in Atlanta. As a health system, Grady's a one hospital system compared to many of the others in the room. Today, our COVID census is 53, but I think it's worth noting almost 20 of those are from more recent admissions from a few nursing homes that have seen an increase. So if you look at just community spread that has come into Grady, we're only at 34. A month ago, we were at 20. During the July peak, the hospital got up to about 105 patients. And so we begin to see an increase, but not at the rate we did during the last wave as rapidly. Of course, everyone in the room is a bit concerned about the fact that it is increasing, and the hospitals are working together closely on our discussions about at the hospital level, how to prioritize vaccine. As the census increases, what do we need to be doing about visitation going forward? Bryce Gartland from Emory chairs a group that meets every week, made up of the chief medical officers of the health systems in the metro area. And I think that group has committed themselves to making sure we have as standardized of approach as we can in the metro area. Grady, of course, took part in the remdesivir trial, the steroid trial, and now is participating in the monoclonal antibody research. We have had a couple of patients this week that went on the monoclonal antibodies, but the full-blown program will launch next Monday. And so we expect to see much broader use of monoclonal antibodies, but it's very, very specific criteria for those patients. And then closing out my little piece, I just want to thank the governor. And again, I've done this a lot, but in this day and age, the governor has really helped the health systems in messaging around masking, distancing, and washing your hands. all your Facebook posts, your social media work, your precedents, you've reiterated that, and that's something we are appreciative of, and together we are preaching like crazy. And so we really appreciate that.
John, one thing I'd like to hear, if anybody has anything interesting about like the people that, the COVID patients you have, I know you mentioned some of them come from nursing home, obviously that's something we've dealt with in the past, but are you seeing anything out of the other populations as a, you know, like when we started school back, or at least the universities had a lot of younger people. Is there any like trends you're seeing with who these individuals are?
It's been interesting to look at the data from wave 1, 2, and now 3 and how different those are. For example, with what we're seeing now, the percentage of patients requiring critical care for us as we're beginning to climb is not changing at all. Actually, it's staying at the same raw number, which means a lower percentage of patients. The patients that are being admitted are from all over the whole spectrum, but not college age, not kids, not grade school, but 30-somethings, 40-somethings on up. And you know, when through interaction with the patients, you learn that some don't have a clue where it came from, and some said, yeah, well, we had a little family get together in the backyard, and we know that that's not a good thing, but at least for us, it has been pretty widespread. Now, Grady does serve a majority minority population, and so the vast majority of the people we're seeing are African American and Hispanic.
Lloyd Howard, President and CEO of Tanner Health System, a hospital system mainly serving suburban and rural areas in the West Georgia. Governor, I want to thank you for the many times you've invited us to participate. We do feel that we are in better shape to deal with this crisis with the support from your office and all the agencies. It's really made a difference for us. Our census is in the 60s to 70s, COVID census, and we're really at overcapacity from a hospital perspective, so we're struggling with that, just do not have enough inpatient beds.
That's everything.
Yes,
right?
that's correct, right, that's correct. And, you know, we're managing our COVID situation, but they are trending up, and thanks to Commissioner Berry, we're adding beds, and we're just trying to bring those online. I think our biggest issue that we struggle with, as you already pointed out, is the staffing. Continues to be a struggle, and we're working through that. We're holding our own right now. We're just worried about, I think they are predicting maybe a surge in Carroll County, like there are other areas, and that we're worried about that right now. But we just can't get the vaccine soon enough for our healthcare workers.
General King is chomping at the bit.
Yes, sir.
Governor, I'm Bill Lee at Evans Memorial Hospital, 50-bed hospital in Claxton, Georgia, about 50 miles west of Savannah. I guess I'm representing the rural hospital contingency, and unlike many of the big bed facilities here, we have struggled in many different ways. We currently have a census of 5 or 6 COVID positive patients. So when you're thinking about 50 beds, that is a significant number. We have since Thanksgiving seen an upsurge and actually had 2 COVID related deaths yesterday. So we are seeing that relative to our county and the populations we're serving. We, you know, our biggest concern right now is not really equipment. It is education. We are seeing a lot of non-mask wearers in our community. We've had multiple campaigns. I've worked closely with elected officials and others trying to get that out in our community because I think that is part of the education that we need to continue to push forward. The other thing that is terribly problematic for us is staffing. And when you're a 50-bed facility, and we have, and it's sobering numbers that we pulled yesterday, since July, we have tried to hire 18 RNs, meaning that we have made offers, accepted, onboarded, and to date, we have had 6 that have successfully gone through the process. They've left for some reason, either in complete orientation, we've had 3 no-shows. I mean, these are professional positions where we've upped dollars and thrown money at that, and it still cannot get workers. And then the other sobering numbers is we had 6 RNs that were over 62 years old that decided that they were going to pursue early retirement and leave us because they did no longer want to work in that environment caring for those patients. And again, that was long thought through, but all those together has really created a perfect storm for us. And we have been recruiting vigilantly, and I'm grateful for the help. We did get some travelers and help assistance with the state most recently. and that has been a savior for us. But quite frankly, we couldn't hardly admit the patients we have if we don't get nursing and support team into the facility. And that's part of the rural hospital struggle that we're seeing. And so we want to be an extension of the larger facilities in our area, but it's just become very problematic. And much like Floyd, thank you so much for your phone calls, for your support, your visit down to Claxton. I really appreciate what the governor, what you've done and your office has done to support us.
Hi, Candace Saunders, President and CEO of Wellstar Health System. We have 11 different communities that we work with throughout the metro Atlanta and Georgia geography. Right today, we have 285 COVID patients in-house. But to give you some perspective on that, our high back in July was around 420. We're continuing to see a lot of other healthcare needs. So we have about 2,700 beds to give you some idea of the order of magnitude on it. But we are just kind of seeing a steady uptick in it. To your question about the type of patients, it's all over the map. We are working closely with our universities in the area because we have seen some parents and college students over the last few weeks, some from the nursing homes, but it's just really all different types of individuals. Back onto the key areas, obviously, is staffing. We have the space right now in the different, and we even have ICU beds, but it's a continuous effort daily on the staffing. We have just been so grateful for the help from the state because that has been critical to us. And having those nurses and physicians focused on the COVID patient care allows us then to give some rest to our other team members, but also to focus on the other healthcare needs coming in so we can keep that access open. So it's been critical to our success in that area. But staffing will continue to be the key area in our nursing homes as well as in our acute care settings, home care, and our other areas. The other areas on the supply side, we continue to do well with that. Obviously, we continue to partner with the state on that. We are starting to see some pricing challenges with our vendors. And so it would be helpful if we continue to join forces on that because of we are just starting to see some upticking in the price that they're trying to bring forward on that. And that goes hand in hand with the testing then is on test kits. We have them right now, but we had a couple situations last week with if we didn't have the multiple testing platforms, we would have run into some issues. So again, it's something that we're having to work on daily as a system. And then we are so appreciative of the different efforts on the state part to get us therapeutics, because that really is helping. And the fact that you've been able to get us access and to work with us on that, we think is making a difference in the care model for these patients. And we're seeing them be able to move quickly through the care setting and get home. So that's something that's been very helpful.
Are y'all still using remdesivir?
Yes. Yeah.
And then the one question I had, Candace, and this is, kind of anybody else who wants to mention this on your remarks, but just the volume, non-COVID volume, is there anything that is causing that? Is it still backlogged from when, things were shut down early on, or is there something else going on, or what's causing it?
I would just say that in the early days, we saw it more backlog. And we're still seeing some of that because not everyone's been, quick to come back in to the hospital, even though in the messaging, it's very safe. The only other area that I would mention is as we look at the type of patients, we're still seeing in our trauma network
I was going to ask.
increased volumes of the trauma. And
John, you seeing that too?
And our ER volumes are down, but our trauma volumes are up. And the type of trauma is also, it's much more penetrating trauma in addition to the automobile. But that is another type of patient, and that's driving up the ICU usage too.
Kevin, are y'all seeing that in your metro facilities too?
We are. December typically is our busiest month. In prior years, we didn't know what was going to happen this December, but some of it is, I think, just the normal trend that we've seen year over year.
The trauma issue is significant. Our trauma volume in November versus 2019 was up 106% in the level one trauma center over the year before. So that, we experienced our flood a year ago next week. And about 180 of those 220 beds are back online, but we're at 104% occupancy with those beds back online. I think the other population that I would say is making up some of that are folks who, with chronic disease, that during the earlier part of this epidemic or pandemic, forego care and are now in worse shape and are ending up hospitalized from chronic disease.
You asked about flu, though. We only have eight. We've only had 8 patients in-house in November for flu. It started picking up toward the end of the month, but it's been very low.
We've had 3.
And keep it on that topic, there's another population that's not coming to the hospital, and that's people that aren't getting sick, that might have kids aren't getting, TNAs, and our pediatric units volume's down, even though we're still having babies and we're still having some of the other things, but people aren't getting as sick. Stress is, who knows what it is in places, but there is a population that just would have been sick that's not because they've been isolating.
Right.
Don, why don't you introduce yourself and go ahead and give your remarks, and we'll come back to
Okay.
Scott, just so the media can keep up with who's saying what.
Sorry about that.
That's all right.
I'm Don Avery. I have the privilege of leading Fairview Park Hospital down in Dublin. Been there quite a while, and it's part of the HCA system, which is noteworthy in and of that we have kind of several HCA hospitals down in that area. We're actually the 190-bed hospital, but we're the largest hospital between Macon and Savannah, which is a unique opportunity, actually. We're rural by definition, but we're more of a rural referral hospital, and by design, I think, and by preference. And so we serve a dozen counties. We offer a lot of services down there. And kind of our observation has been, there has been, as Candace said, a slight uptick. But if I look at the past few months, we pretty much stayed, for me, if I say we have 25 or 30 patients that are COVID, that probably represents 25% of our inpatient population. Memorial Hospital yesterday had 42 inpatient COVID patients, and that represented probably 5 or 6% of their volume, whereas we had 28, which represented 27% of our volume yesterday. And so it's, from a percentage standpoint, you look at that a little bit differently. One of the things that we've done, which everybody at this table has done, because of the cooperation John mentioned earlier amongst the state hospitals, we have, like most people, have better clinical protocols than we did a few months ago, dealing with, drug protocols and vent protocols, et cetera. We do a better job at planning and preparing for surges. And I think, again, the teamwork I've seen throughout the state is a big part of that. We've had to come up with some different nursing models. There's not enough RNs out there. By the way, the state, through GMA, through FEMA, have had some programs that have helped us tremendously. We have probably a dozen nurses right now that are being funded by that program. You mentioned, Governor, that you've helped 50-something hospitals. My guess is you've helped over 170 hospitals in the state, and I think there's 179 hospitals. You probably helped all of us, and all of us are thankful for the support we've had from Atlanta, from your office. But I do believe that we're seeing a couple other trends. Fewer and fewer of our COVID patients are winding up in the ICU. Used to be a high percentage of them did, and we had lengths of stay at 40 or 50 days. Our average length of stay virtually every month, I see it going down just a little bit more, and fewer people are being put on vents. So there are numbers that are up, but people don't seem to be as sick. And a lot of it's the protocol, remdesivir and proning and plasma, any number of things. And so the positive patients in Middle Georgia, as a percentage of the tests, has gone down a little bit. And again, what we're seeing is there are more people. Some of that's probably due to testing. Like everybody else said, my biggest fear of Thanksgiving was not just family gathering, but all the college kids coming home and bringing virus with them. But it's a stressful time. But as I've said this whole year, What a great time. But isn't that what leaders are trained to do, is lead during times of crisis? And we should embrace that.
Thank you. All right, Scott, we'll go back to you.
All right. Scott Steiner, I'm the president and CEO for Phoebe Putney Health System in Southwest Georgia. We have 3 different hospitals there. The main one is in Albany. Governor, just again, thank you for everything that you've done. You were in the fight early on, back in March. I know
You were too.
we were wearing you out, and probably Ryan a little bit more, but
Early on.
we were early. I think we were 4th in the world at one time, Albany, Georgia was. You know, we've got 37 patients today in our facilities, most of them in Albany. About a third of those are in the ICU, though, you know, it's kind of borders between should they be on the medical floor or the ICU, so they're not, I don't think any of them are on a ventilator. So we're seeing what everybody else is seeing. It's a different patient than was in March, April, and certainly in the summer. Same challenges, staffing, you know, to get a nurse now, the rate's 120 an hour, 130 an hour. Before this, it was 60, 70, 80. That is certainly pressing resources. You mentioned that certainly the state has laid out quite a bit of funding for that, and we thank you for that. You know, we're focused now on surges. Right now, we've staffed to go to a surge of 50, which isn't, we're 13 away from that. We believe in 2 weeks we can go to 86. We've got facilities to go to 100 because of a lot of the help you have in staying up BB North, the modular unit. So we've been kind of, you know, trying to play read the tea leaves a little bit about where this volume is going. We have seen a slight, 2 weeks ago we were at 22, now we're at 37. But about 10 of those 37 are from outlying hospitals, mostly critical access hospitals that have transferred, that weren't transferring over the summer. So they're getting pressed and needing a relief valve. So we've been happy to be able to do that. I think one other area of concern outside of staffing is, you know, we're seeing a little bit of from our supply chain. There's some opportunistic suppliers. I would tell you one of them is a well-known PCR rapid testing company that has now basically said you need to sign a contract for 2 years in order for us to keep supplying you with reagents. And you know, and the PCR COVID test is now part of a panel, right? We don't need the panel, we need the PCR test, the COVID, but the panel, of course, is, you know, 2 or 3 or 4 times as expensive as just that test is. And now they want us to sign up for 2 years and to take a quantity for 2 years every month. So again, you know, not exactly what we need today, and understanding that, you know, it's a capitalistic market, and maybe if I was on their side, I might think that way, but it sure seems in poor timing at best. But you know, luckily there's others entering the market as it relates to testing. The rapid testing still is a bit of a challenge, and Quest and LabCorp continue to have good weeks, and sometimes it hasn't happened.
Well, thank you.
Appreciate it.
Rush?
Yeah, so Bryce Gartland, I'm the hospital group president and co-chief of clinical operations for Emory Healthcare. So 11 hospitals, just around 2,800 beds or so. And, you know, first of all, like colleagues would just like to say, really appreciate all the support from the state, not just yourself, but your team. I know Commissioner Berry and myself have interfaced a lot on a variety of other issues. You know, we're well into this 3rd surge. You know, at this point in time, I think it's important for all of us to stay grounded that this 3rd surge is very different than the 1st and the 2nd ones. This one is much more insidious in nature. It's much more building in nature. There are some patient demographic differences going on. I can tell you for us, we've seen an increase in terms of the distance that people are coming to actually present to the hospital. It's now increased by about 12 miles in terms of how far people are traveling to actually come and be admitted in our facilities. Can't say that that's common across everybody, but it is something that we've noticed. Tends to be a little bit younger population by a couple of years from what we've seen prior. It is dropped in terms of ICU utilization. It's down at about 30% compared to around 42% the first go round. Deep drop in ventilator usage. It's more around 50 to 55% compared to 75%. You know, our average daily census right now, we're up at 203 today. It's up 50. It's basically doubled in the past month in terms of volume. And, again, back to why it's different, right now, this is almost in some ways almost more reminiscent of the first wave than it was the second wave, in the sense that the non-COVID related care has really picked back up. And those non-COVID cases are very sick. For those familiar with case mix index, a couple of us were talking about this outside. The case mix index in some of our hospitals is up a full quarter point, 0.25%, in the past several months, which is just astronomical. And, while we're all focused in on caring for those COVID individuals, we got to remember that those non-COVID individuals have equally as important issues. Many of them, in many circumstances, is more lethal than actually COVID
So
itself.
are you saying that number's being driven by non-COVID
Being
patients?
driven by non-COVID
I just
patients.
want to make sure I understand.
And so I think it's important for us all to kind of, stay grounded in that. I think you incredibly well articulated out, several of the issues, and I'll kind of just highlight what I think are the top three, which is staffing, number one. While Emory's not tapped into state resources right now, I can tell you our contract labor, we went from 130 contract RNs to over 500 contract RNs at those rates that Scott was articulating out. That is incredibly taxing on the system. It's unsustainable. I am concerned that Georgia's later into this third surge, which means that we may be at the back of the line in terms of national access to a lot of that contract nursing staff. And so we have to just continue to stay, up on that. Number two is some of the supply chain, most particular on the diagnostic testing. That has still been probably one of the most fragile supply chains in terms of being able to really stand it up. And the third one is COVID fatigue, and I think we've all got it, both personally and professionally. I think our frontline healthcare workers have it, more so than anybody else, but we have got to stay up on the messaging in terms of, not letting the guard down at this point, particularly as there's a lot of excitement about the vaccines. The reality is that, kind of the mass distribution of these and the like is still months away. It's not days or weeks away. And so we've got to stay up on that. The last one, maybe to put just a plug in here of something else to think about, is around the mental health population. Many of our hospitals are struggling with that on a day-to-day basis. You throw mental health and COVID together, it is it's a real challenge to try to solve for that. And that may be one area where collectively we can really come together to try to find some solution to manage that, because you take a very heated ER environment, you throw some mental health patients on top of that, it becomes that much more of a complex and stressful setting. And so maybe one additional area that my colleagues have not mentioned, but again, would just like to say, thanks for all of your work and support and advocacy. It's really important for us.
I could just add, I think that also really applies to our frontline workers. Their mental health.
Well-being, yeah.
Good.
I'm Kevin Brown. I'm the CEO of Piedmont Healthcare. We also have 11 hospitals and a whole bunch of clinics. And try not to reiterate the same story that everybody has just articulated, because it's the same picture at Piedmont. Governor, I want to thank you for your leadership. It was mentioned you started at the front of this and you've stayed through it, keeping us informed, calling us together, even spending time on your Thanksgiving to deliver donuts to one of our facilities.
Seems like 2 weeks ago.
Socially distanced and outside, but I can tell you that message, you talk about the mental health of our staff, I've heard it over and over, how much they just appreciated the gesture.
I wish I could have done it for everybody.
We'll share our donuts. But very much appreciated. And the same with your staff, Commissioner Barry, Dr. Toomey, Ryan. We've had a joint unit that we've been operating at Piedmont, Atlanta. That's just been a home run, and the staff, the leadership, and the management at our Atlanta facility just rave about the support that they've gotten from the state for the COVID expansion unit. And that's doing well. Overall, our census we were at 378 COVID positive patients this morning, which is about 20% of our overall census. At our peak in July 22nd, we were at 512. So we're still 20% below where we were at the end of July. At the end of July, like everybody in the room here, we prepared for now. So we're stocked up on PPE. We thought we were supplied with nurses, but we're continuing to see the same trends, where we also made a large investment in agency nurses. I heard this morning from one of our agencies that there's 10,000 agency nursing positions unfilled at the moment across the country. So we are on the tail end of a lot of places that didn't get hit like we got hit in March and July, other states. And so, coming on the tail end of that, we've lost nurses to it. And again, some of the national supply of agency nurses has just been taken up. So we're also being creative around being safe and secure, but also making sure we're staffing in ways that allow us to take advantage of the staff that we do have. With that, the only other supply issue is the same thing with test kits, and specifically our Avid ID Rapid, similar to what Candace mentioned. We're fortunate that we have several different platforms that we rely on, but that one has been a challenge to us. Better in the last couple of days, but again, one that we're watching closely.
We'll check on the test.
Yeah, Wellstar, Piedmont, Grady are all big Abbott shops, and fortunately, we all three are on that platform. And yesterday, Piedmont Atlanta ended up sharing their reagents with us, test kits, which was a game changer. But it's really the first time I think we've gotten into this condition with Abbott.
Anna, you want to give us an update from an association standpoint?
Thank you, sir. Anna Adams, Georgia Hospital Association. First of all, we'd just like to say thank you to you and your incredible team, Commissioner Toomey, Commissioner Berry, Commissioner King, for everything that you've done for the hospitals throughout this crisis. I don't think that anybody feels like you've been reactive instead of proactive, and we appreciate you reaching out with solutions and putting your finger on the pulse to make sure you understand things before they become a crisis. So that's been incredibly helpful. You've heard from many of our members today about the main issues that they're facing, and those are the same kinds of issues that I'm hearing from other member hospitals in the state who are not present here today. But staffing seems to be the #1 challenge for many of our issues, and there is concern that moving past, Christmas and into January, as we continue to see these numbers rise, that these are going to just get worse. Another issue I think that's been first and foremost on a lot of these members' lists are being able to discharge patients to a lower level of care in a timely fashion so that we can free up those beds for other patients, not just COVID patients. And we are seeing some surges from non-COVID patients, and I think some of that is related to the fact that it's the end of the year. Many patients have met their deductible. And so they're trying to get in things like knee replacements, hip replacements, things that they've put off throughout the year. So that's one of the things that, we're trying to make sure we can move these patients out, not just COVID, but other patients to free up those beds. Access to the rapid test has been an issue that's popped up a little bit over the last several weeks, which I know is a statewide concern. And then a couple of very specific PPE issues that I think we've been able to help develop some partnerships within our state so that they can get access to things like masks and gloves and gowns again. But thank you again for your partnership, and thank you for working with us on messaging for the state. We really appreciate you.
Well, thank you. I know we got just a few minutes left. I want to give General King and Commissioner Berry and Dr. Toomey just a minute or so to give us a quick update, General, on the distribution.
I had a great opportunity to go up to Gainesville this morning and really had a great opportunity to sit down with the leadership of that hospital. And it's just traveling outside of Atlanta and going into your hospitals, you can just see the tremendous amount of just the growth in knowledge. And I've had the privilege of being able to travel all over the United States and see hospitals operations. For a non-doctor, I'm very comfortable now walking around your facilities. And I know what right looks like. And consistently, that's what I see here in Georgia. And there's a lot of challenges, as you said, is people being able to discharge, or at least being discharged into the facilities that don't require the level of care. Is artificially, I think, using up some important bed space that I think we need to be able to create that flexibility to deal with the potential upticks in infection. And so we're looking at our authorities, sir, to probably republish probably some suspension of pre-authorization requirements, because a lot of these hospitals are waiting for an answer from insurance companies to be able to transfer a patient that's occupying a bed or waiting for an aid, especially over the weekend. So we're looking at our authorities, and potentially we're publishing something pretty soon to be able to give a little bit more freedom and more capacity to our hospitals.
Great, thank you. Brian?
I just want to echo what the governor said and thank you for what you've been doing. You guys have been at the front lines and we just can't thank you enough. Matt Hicks, 24/7, Anna, 24/7, representing the various groups. Just, we're very grateful and thankful for what you all have done. And the whole team's worked, I think, with every one of you. And it's just been an honor of a lifetime to work with you. And Governor has said time and time again, give me options, give me options, give me options. And he's just been nonstop, multiple times a week.
Thank you. Yeah,
So,
too.
yeah.
Dr. Toomey?
Yeah, no, thank you. And it's been a privilege for us to be working with you as well. Not just our state office, but our district health directors who work so closely with you. And we're really very much looking forward to rolling out this vaccine. And your staff, I hope, will be happy about that. And I wanted to just ask you, I'm getting feedback from Grady staff and others that they are not going to get vaccinated, or at least going to wait a year more. And I don't know what kind of vaccine hesitancy you're seeing among your staff. And just asking your advice, what can I do? What can General King do? How can we work together with you to really get beyond this? I really feel very strongly the data look just superb in this.
I'm on Thanksgiving Day, I asked every single one of my nurses, and about 50-50 whether they were taking it. There's a lot of hesitancy. I think it's just fear, some of it's ignorance, but just to echo your point.
Well, and I think, that's something that Dr. Toomey and General King and I have talked about, and it's going to be a big part of our messaging. I mean, we've been obviously focused on getting the logistics set up and figuring out, who and working with the long-term care facilities with the whole CVS, was it Walgreens partnership and the federal government, and then, kind of what we're going to do on the other side, getting people to sign up. But that's going to be a big part of the mission when the vaccine arrives, is to try to get people comfortable with taking it, and we'll be very involved with that.
Yeah, I think one of the issues, and it's a byproduct of the speed, which is great, of getting these to market, is that the experts, we're a big infectious disease center. The physicians are Emory-based. We've got some of the world's leading researchers in infectious disease between those two places. And they're just not getting their hands on the core literature related to these drugs to be able to make that judgment. And I think it's going to be instrumental that people with that authority and knowledge, Department of Health and the state, are able to tell the story. So here's what the data tells us. Here's what the science tells us. And hopefully that'll help allay some fears.
Maybe that's something we need to talk about.
Yeah, and one item I would offer up for you on that end is, so Nadine Raphael, who heads the Emory Vaccine Center that's leading these trials, both at, Emory, Grady, the Hope Clinic. She is probably one of the world's leading experts when it comes to this. They're very confident, in the data that's coming out. And actually taking it the next step further, there's another great, partnership that's developed in terms of how to penetrate into some of the underrepresented, higher risk, areas of kind of partnering that, expertise along with that outreach that can really help penetrate some of the community message.
And I think we also need to remind folks that people participating in these trials were Georgians.
Right.
A great deal of them. I tell you, Moderna, your trial, these are fellow Georgians.
Right.
They've undergone this trial, and that is I think it's an important story, part of our story that we need to tell. It's not some stranger, some state, or some other country.
Well, and many of them, to be honest, of the ones who received the actual vaccine that were in our clinic, are willing to tell their story, and that could be a part of
I
that.
think
All right, I hope this was informative for everyone on the call. I appreciate everyone joining us again. If you need the remarks, please shoot me an email, and we'll follow up. Thanks.